Now, one of the interesting things about our program is that it's a DNP only nurse practitioner program. Now, a lot of you might be thinking, why did I sign up for this? And your friends, coworkers might tell you, or might ask you, why do you sign up for a DNP program? Why don't you just go get a master's degree? Isn't it cheaper? And the answer is, well, it is cheaper if that's all you ever do. But if you ever decide that you want to go back for a DNP, then it's actually cheaper just to do the DNP up front. The other interesting thing is that the DNP is not just additional school, additional hours. It actually prepares you for something different. So what is that something different? And what I find is that a lot of students, either they can't articulate it or they don't actually know. So what distinguishes a DNP graduate nurse practitioner from a master's degree nurse practitioner is that the master's degree nurse practitioner has been prepared to take care of one patient at a time and provide care to that patient. A DNP prepared nurse practitioner should have a couple additional things. One is a more population focus, and a more systems approach. So instead of how do I take care of this one patient here in front of me, it's how can I transform or change the healthcare system, particularly the part that I work in, to improve the health of everyone like this patient. So that population focus is one of the biggest differences between a DNP prepared nurse practitioner and a master's prepared nurse practitioner. Now, the other thing that a DNP person should be able to do is to implement systems change. So throughout our program here at Palm Beach Atlantic University, you're going to be examining how can we improve the systems that we're in. Now, the very first step in improving something is to assess it. And the very first part of a research study is to have a research question. So before you can have a research question, you have to have some kind of idea of what you want to know or what you want to ask. So for what we're going to do is, in this course, is we're going to set the foundation for that with listening skills. So anytime you take care of a patient, the first thing you should do is an assessment. Anytime you want to improve a system, the first thing you should do is an assessment. Anytime you're a leader, one of the most important things you need to do is an assessment of the situation, of the setting, of the people that you're working with. So what we're going to do in this class is we're going to do a little exercise that'll help prepare you for your master's or your doctoral project, your practicum projects. So in those courses, what you're gonna have to do is you're gonna have to go into a practice setting, you're going to have to do an assessment of that setting, and then you're going to have to design a quality improvement project that tries to improve something in that area. So what we're gonna do right now is we're gonna practice that assessment by an assignment they're going to have in Module 1, preparing you to go into Module 2. So what you need to do is have a conversation with the nursing leader. It can be your unit manager, it can be, if you're still a student, you can be a nurse preceptor, or it can be a nurse that you know, but it just needs to be a nurse leader of some kind. And what you're going to do is you're going to ask them about the problems they face. Now, one thing to warn you about. It's really easy to come up with people problems. So the doctors don't want to do this. Nurses do that. These people won't do that. Those people won't do this. You know, those are more management problems than they are true nursing problems. So we want to focus not on that kind of problem. What we want to do is we want to focus on questions that are a little bit more nursing, perhaps a little bit more clinical. So some examples would be, instead of, well, I can't get the physicians to do X, it would be, well, we have this issue with patients becoming dehydrated. And so the solution to that problem might involve getting physicians to do X, but it might be that nurses do Y, or it might be that we set up the electronic health record to do a prompt, or it might be that we have to change the billing practice. So focus on the clinical needs, the clinical area that needs improvement, rather than a people need that needs improvement. Because this isn't really, the focus of this course is not on leadership and interpersonal stuff, it's on quality improvement and how science and research plays a role in that. So that's the first thing. Now, what you're going to do is you're going to ask them a lead-in question. So here are some lead-in questions that you could use. What are the problems that happened on your floor? What's the most... Let's do that again. So here are some lead-in questions that you could use. What are the most important problems that you face in terms of patient care on your unit? What area is costing you the most money right now on your unit? What areas have you been flagged for improvement? How do your EBMs compare to the rest of the hospital? So when you ask these types of questions, or maybe HCAHPS scores, when you ask these types of questions, you're going to start to get an answer. And what I want you to do is don't just take that answer at face value. I want you to ask follow-up questions. And there's only two that you need. And one of them is not even a question. One is, what else? And the other is, go on. So what you're doing is you're trying to dig deeper into that problem. It's really easy to get a list of a whole bunch of problems and not really understand any of them. What we want to do is we want to get to a deep understanding of the problem that we're going to try and solve, or that we're going to try and address later on. So you want to go deep into one problem, not just shallow into a whole bunch of problems. So you're going to ask a lead question or two, and then when they give you an answer, you're going to say, what else? And go on as follow-ups. And now, when you get to something very deep, you're going to try and restate what you think the problem is back to that nurse leader. And they're going to say one of two things. They're going to say, no, that's not right. That's not it. And if they say that, then you say, okay, well, go ahead and tell me what it is again. And repeat that what else, go on process until you get the other response, which is that's right, or that's it. So when you can say the problem back to them and they say, yes, that's the problem, you know you've got the problem. There's an interesting saying in sales, which is if you can listen to a person and you can state their problem better than they can state it themselves, they will think that you are an expert and they will expect for you to be able to solve their problem. And that's what we're looking for in this case, is to be able to say the question, the problem so well that they assume you're competent to be able to answer it. Now, one of the other things that a DNP prepared nurse practitioner, or any DNP nurse should be able to do, is to lead quality improvement change. You could, after graduating from our program with your master's, and especially with your DNP, be able to work as a consultant. Now, how many of you have ever worked with a consultant? A lot of times you bring in this person who's supposed to be an expert, and they come in and they do all this change, and how often has it worked out and how often has it not worked out? How many times have you seen a consultant who comes in and they make all this big waves and we do all these stuff, and then it either doesn't work out, or within like a week's time or a month's time, everything just goes back to the way it was? And why did that happen? It's probably because the consultant didn't really understand the core issues, and they didn't understand what was going on in the culture of that place. So we want to make sure, actually sometimes what you'll see is consultants who have the same cookie cutter approach, and they just sell that to every single organization they go to. And so if it happens to work for you, great, but if it doesn't work for you, oh well, you know, it's the shtick they have. They sell everyone the same cure. So what we want to do in our little pretend practice assignments that are going to help us become potential consultants is we want to start with a really great assessment. And the way you do that is by asking those questions. And the important concept is don't go surface level, go deep. And to go deep, you need those two follow-up questions, what else, and go on. What else, and go on. Don't just stick to the very first thing that you get.